Hello, and thank you for attending the Workforce Flathead Opportunity Fair today. We are thrilled to have with us and to be learning more about Benefis on this virtual platform. My name is Jody Smith, and I'm the Workforce Training Director in the Continuing Education Center at Flathead Valley Community College, and I get to be your moderator for today. A few housekeeping items first. Some of you may already be well versed at finding the recordings, but every single session, including some of the information sessions with a lot of tips and tricks for careers and job searching, can all be found at the workforceflathead.com website, as well as the YouTube channel through the Kalispell Job Service. And so both spots have a great repository of all of those resources, and I really encourage you to go out and check out some of the sessions that surely you haven't seen them all yet. And we will plan to save some time at the end of this webinar to take any questions that you might have. So there's a Q&A feature down at the bottom of your screen where you should be able to enter those questions, and I'll be looking to monitor those for the end of our session today. But we are excited to have Holly Schulte with us and to tell us more about Benefis. So Holly, I'll turn it over to you, and thank you for being with us today.
Oh, wonderful. Thanks for having us. Again, my name is Holly Schulte. I'm a recruiter here with Benefis Health System, which is located here in Great Falls. But I'm from the Flathead Valley. I grew up in Kalispell, graduated from Flathead High School there, so feel a little bit of a connection still. So I'm just here to talk a little bit about the opportunities that we have here in Benefis and some of the opportunities even via Benefis that we have there in the Valley too. So the mission and vision here at Benefis, the mission is to provide excellent care for all, healing mind, body, and spirit. And our vision is to be a best health system here in Montana. Some of the kind of kudos that Benefis has, we made the Becker's Hospital Review 150 top places to work in healthcare for 6 consecutive years. We were America's Best Employers by Forbes in 2018 and America's Best In-State Employers by Forbes in 2019. So some of the cool accolades that we are proud of for sure. Benefis, kind of by the numbers, we have close to 3,500 employees now. Over 936, probably closer to 1,000 of them are nurses. And we have close to now 300 employed providers here as well. We are a non-union, nonprofit hospital health system. So I know a lot of the health systems around the state are union. So just wanted to point that out. We have had annual increases, wage increases since 2003, and that held true in 2020, year of COVID. We also got an annual increase. And we also have a no layoff policy, which we've also had since 2003, which also held true in 2020. We didn't have to lay off anybody. We redeployed them, we honored PTO, whatever we had to do to kind of hold true to the promise of no layoffs. So we serve a vast 13 county region. We do have offices throughout the state, I think in every county but Missoula County, with our home and community-based services. We do have 5 campuses, like big campuses, 4 here in Great Falls. And then we do have a rural access hospital up in Shoto, Montana, which is about an hour north of us here. So we do serve more than 86% of the state. And here in Great Falls, we are the 2nd largest employer to the Air Force Base. So we're the largest employer, like public employer, I guess you could say. We do have market-based compensation. So every year our compensation team does market analysis on all the positions and wages. So oftentimes on top of the annual increase, we also get an increase in our wage, just depending on if that position gets a market jump. We have shared governance, which is a huge employee satisfier when it comes to our clinical positions. So decisions aren't made from like 4 top executives for the whole health department. Decisions are based on a unit level. So you do kind of what works best for your department. And that's everything from like how you schedule to how you celebrate birthdays and everything in between. We have an excellent benefits package. So we have 2 health insurance plans to choose from. And one of the health insurance plans, you get to access our employee health plan clinic for free. which is a clinic that only those on our health insurance and their dependents can access. And on the other health plan clinic, it's just $45. So I just give the example. I have young kids, and before we had this health plan clinic, we would go, daycare would call us and they would say, the kids have temperatures, you need to go to the doctor and have a doctor's note before you can come back. So I take them, they're twins, so I have two. I would take them to the urgent care. They would tell me, oh, this looks like it's something viral, just go home and take Tylenol. So I go home, a couple weeks later, I get a bill for like $300, essentially for nothing. So now I just go to the health plan clinic. I am on the health plan that does not cost anything. So for the visit. So I go, they tell me they need Tylenol, and I don't get billed for it. Now, if you did need to have labs or x-rays or something done, then those would be billed, but the actual office visit on the one plan is free and the other one is only $45. Let's see, we have a 403B pension plan, which is like a 401k, but it's a 403B because we are nonprofit. The biggest kind of perk with that is that at your 1 year mark, if you are contributing 2.5%, Benefis will start matching, but we'll do 5%. So they're matching and doubling your contribution. And after 5 years, you're fully vested. So that just means that if you were to leave after 5 years, all that money is yours. Which at other companies I've worked for, it's been kind of 7, 8, 9, 10 years. So that is great as well. We have had employee satisfaction scores greater than a 4.0 on a 5-point scale for the past 9 years, which we do throughout the year, like 3 or 4 times a year through our employee forums. We have, on top of the annual increases, we've had annual bonuses, which I call surprise bonuses because they aren't planned and we don't know about them until we receive them in our mailbox. But those have been given in 2017, 18, 19, and even in 2020. It's like an extra paycheck that you don't know is coming. So really great surprise. And then we also have the 340B pharmacy access grant, which is like, I think we might be 1 or maybe 2 in the state that have this grant that offers up to huge discounts on like inhalers, EpiPens, things that people need religiously that spend a lot of money on. Educational opportunities, we do offer tuition assistance for continuing education. We don't have tuition reimbursement for prior education, but do offer help if you wanted to continue on. All of the ABC classes are free if you're a Benefis employee. So if you need to renew your, your ACLS or your BLS or whatever it might be. We do have professional growth and technical growth programs, leadership courses, certification pay. So if you have a specific certification that applies to the department that you work in, you might get an extra pay on top of your hourly wage, as well as other programs for like ops specialist, charge nurse type things. We do offer job shadow and clinical experience programs, scholarships for CNAs and CMAs, and on the job training opportunities for our lab and pharmacy, which is awesome because we can pull people in who have no experience and they can, be working in our lab as a lab assistant. So turnover rates, you can kind of take a look at this graph. So obviously it's national versus Montana versus Benefis. So nationally, the turnover rate is 15.4. In Montana, it's 18.3, and at Benefis, I believe this is for 2020, was 11.7. So you can see that we're, well below both the state and national average. And then you can kind of see the RN turnover there on the right as well. So if you're interested in pulling the trigger and working here at Benefis, these are just some of the positions that we do have available. The ones kind of in the bigger, bolder text are, ones that we are, very heavily recruiting for currently. Everything from office positions to clinical positions to certified to non-certified, everything is listed on our website, and we'd be happy to answer any questions for anybody who's interested in any of these positions. And then, here we go. For those people who are interested in working at Benefis, but don't want to leave the beautiful Valley, understand that. We do sometimes have openings there in our HCBS office. So right now we do have an opening for a full-time nurse case manager there in our Kalispell office. It's for an LPN or RN. And then we also have potential future openings for our social worker case manager and then some administrative positions as well. So definitely want to keep a lookout. We usually advertise those in the Interlake and the Beacon as well.
Holly, did
Yes.
you say what HCBS is?
Yep. So it's home and community-based services. So we have those offices throughout Montana, and they are kind of essentially kind of like home health. So they do nursing and social work for people kind of in their homes in those communities.
Thank you, and for repeating a few.
Yes, no, you're fine. And those are really beneficial positions because for those who are clinical and used to working nights and weekends, these are Monday through Friday, 8 to 5 positions, no holidays. So kind of still get the benefit of a good schedule. So for those, we do offer a really lucrative residency program for new grad nurses. Always like to touch on that a little bit. Really well-known residency throughout the state. So just a little bit on the different areas that we do hire new grad nurses into, which are most all areas throughout our health system. The starting wage and really lucrative sign-on bonuses that can come with on a different scale depending on what kind of work commitment you want to give to Benefis. And then throughout the whole health system, no matter if you're a housekeeper or a nurse, we do offer shift differentials. So $2 more an hour for an evening shift and $3 more an hour for a night shift. So if you are interested in either learning more about Benefis or looking at our different career options, you can visit our website at benefis.org/careers. This is Ashley, our senior recruiter's information listed below. She was originally going to present this. So if you reach out to her, there's only 2 of us here recruiting. So it's a very personal kind of onboarding and hiring process. But if you reach out to her and we can kind of get you to the appropriate person to whatever you're interested in. So I guess at that, I can take any questions.
Thank you so much. That was very thorough, and those are impressive benefits too. I wondered, is there anything else that you would say personally about what makes Benefis a wonderful place to work?
Sure. So I have worked in several different aspects of healthcare, from like hospital to mental health throughout the state and actually even outside our state. And I truly just am super proud to work here. They are really high on employee satisfaction because they know if their employees, overall are satisfied, that will in turn, make them provide excellent patient care. And we're also very involved in the community. My family also owns a small business here in town. And so I really appreciate the community involvement that they have, as well as just feeling like you're part of a big family. The atmosphere and the culture is unspoken of here. And when we recruit and people ask us, like, what do you guys look for on a resume? And it's, we're not just looking at a resume or, whatnot. We are looking for the right fit. We want you to fit culturally here as well.
That led right into my next question. It's tough probably across the wide scope of positions that you have, but are there generally any particular characteristics that you look for people to join the team?
Sure. I mean, being a health system, obviously we're looking for people who are compassionate and caring, who want to be here, who aren't here just for a paycheck, that want to be part of our different, areas, that want to be part of a big family, and truly, want to give the best care, even if you're in an office position, not next to the bedside, such as like here in HR or something, you're still contributing towards the greater good. And, we just want people who also have those same, mission and vision as we do.
Mm-hmm. Understandable and wonderful. Being here at the college, sometimes it comes up and it's not always a possibility, but are there ever seasonal or summer type positions that can work out there?
Yeah, and we also do like internships too. So if you do have, some college students who, might not have classes through the summer, but definitely want to kind of experience, Benefis, we do offer different sorts of internships. We do have temporary work as well, as long as you're kind of upfront with what you're looking for. We can always see if there's a department who is willing to kind of work with that. A lot of our employees like to take PTO and stuff in the summer. So if you're willing to, cover shifts and stuff during those times, we could most likely find a spot for you, definitely.
That's great. That makes sense. Well, okay. I think that's all we have here today. Anything you want final words that you'd like to wrap up with at all before we go?
No, I think, Benefis speaks for itself, but we, with ties to the Flathead Valley and, love all the people up there. So if you are at all interested in, working at Benefis via our Kalispell office or coming to visit us here at Benefis, we'd be glad to help answer any questions.
Wonderful. We really appreciate you taking the time to tell us more about your organization and share with us for everybody to have the opportunity to learn more. So thank you so much for your time.
Yes, thank you so much for having us.
You bet. Have a good afternoon.
You too, thanks.
Bye.